Howdy guys, welcome to another wonderful lecture. This one is on records and reports. So we're going to talk about reports. Here's what we're going to cover. What constitutes a report? Who might read the report? When do you have to complete it? And what terminology should we use? So what's the purpose? Why do we write reports? Writing reports is something we do for every patient. It's something that happens broadly across healthcare, and we're no exception to that. So why do we do it? Well, first, for continuity of patient care. That means that we start patient care and then we take the patient to the hospital and the hospital continues patient care. And it helps with kind of that continuum or continuing patient care for the doctors to be able to look back at our report and see what our care was. It is a requirement, so one of the regulatory requirements for EMS organizations is that you have to have reports for each patient. Helps with quality assurance and improvement. I don't like the quality assurance because that just means we're staying where we are. We want to get better, so I like quality improvement better. Anyway, it helps us with research. There are plenty of research studies that look at treatments that have occurred in the past and the outcomes of patients. So charts are used in research. Justification of treatment. If you give a person aspirin, for example, it's generally a good idea to have a reason for why you gave it to them. You have to justify it. It's protection for us. If a patient says that we came to their house and we didn't take care of them and we did nothing, but we document in our report that we explained to the patient why she needed to go to the hospital, and we tried to do some tests and she refused everything and she wasn't a very kind person, although we can't say that she wasn't kind, but we can imply that by talking about her demeanor and tone, then it helps protect us if she takes us to court. It's also done for administrative purposes like billing and getting numbers, you know, how many patients do we see in a year, that sort of thing. Okay, so patient care record, or PCR. I'll write that out for you. Patient care record is a PCR. I'll be honest, most PCRs these days are electronic, so we put an E in front of it, ePCR. So an electronic PCR, and this is a patient care record. It can be written out. There are some places that do still use paper. It could be computerized. Regardless, it has to be complete, it has to be accurate, and it has to be legible. Especially if you're writing this out, it needs to be legible. It needs to be readable. It needs to be readable, which means that your spelling errors and grammar errors can't be so horrible that it's not readable by a layperson. We have different types of information. We have objective information, and we have subjective information. Objective information are things that we see, things that we observe, kind of behaviors. Whoops. Subjective information are things that the patient tells us, things that we kind of can't verify concretely. So these are more of your concrete things. The patient's skin is blue. The patient has deformity to their leg. The patient answers all questions appropriately. Those are all really concrete things. Subjective information, this is the stuff that, like your patient tells you that their stomach hurts, right? Stomach hurts. You can't verify that. You can certainly try pushing on their abdomen and see how they react, but the only person who can tell you about pain is your patient. So if you were describing the pain, for example, under objective, you could put upon palpation of stomach, patient moans. That's an indicator that you have pain, and that's objective information. But patient states stomach hurts. See, that's subjective. That's subjective information because the patient stated it, and there's no way that you can really verify that. Obviously, we have supporting evidence, but the only person who's feeling that pain is the patient. By pushing on their stomach, you don't feel pain, so you can't verify that. It seems a little silly to distinguish the two, but part of what we do is we use this to help organize our reports. So So like I mentioned, most of the EMS reports are electronic. They can, generally speaking, be easily shared between facilities, personnel, and databases. Hopefully. If everyone's using the same kind of reports and all that sort of stuff, they're shareable. This does improve the continuity and efficiency of care, and it helps advance evidence-based practice. We've talked about evidence-based practice before, but remember, this is where we actually have science behind what we do. So somebody does some research and realizes that giving aspirin maybe has some negative benefits, but if we don't have charts that we can search from and put into these databases, then we can't get this evidence. So electronic reports are very helpful in that sense. There are many types of EMS report designs, and in some, even the narrative sections have been replaced. It used to be that we would talk about these SOAP narratives, and you'll probably still hear about this, or your chart narratives. And we'll talk about these a little bit in class because I do want you to have some familiarity with it. But by and large, you're going to have a section where you can kind of type comments about the patient's complaints and what you found and that sort of stuff. So a lot of the write it out narratives have been replaced by check boxes or pull down menus. You know, you pull down the menu and then it says something there. Regardless of the form, you have to obtain the proper information, and that's going to include things like chief complaint, name, address, date of birth, billing information, all the important stuff that the administrators like. And then do they take any medicines? Are they allergic to anything? Do they have any medical problems? And then really what's going on?